Trust one, that is protecting your back, ergonomics in the OT and in the OPD by Dr. Thomas George. Over to you, Dr. Thomas.
This is a slightly different take which is relevant to everybody who is working in any job. Ergonomics can be roughly defined as a study of people in their working environment, and typically it's a musculoskeletal system we are bothered about. An extended definition would include cognitive ergonomics, where you need to decrease the need to memorize something and reason, and organizational, that's up to the institutions to deal with. At an individual level, we cannot do much about it. For us, it is primary to understand the instrument that is causing us maximum stress, and I will be going more into the theater situation, the microscope. For completion, this is what a microscope is. It's a single objective lens. The light beam splits into two and gives a disparity in the viewing angle, giving us stereopsis. So the stability of the microscope is the first thing. So you have a foot plate, which is the heaviest part of the microscope, which makes sure that once you've adjusted it, it stays steady, it doesn't move around. It is not just the wheels, it is the weight that is there at the bottom piece that you see on the microscope, and that is actually important in the stability of the microscope. No other lock other than the wheels should be fully tightened, and you can have some friction with frictional locks, but then it should not be tightened to the level that cannot be moved. You're not there for exercise, so it should be easy to move the microscope around. Most OT personnel would prefer to have it locked in a position for their convenience, insist on all joints on the swing arm to be loose enough for you to move around. Typically, it has two joints as pivot joints, as shown here with the arrows on the horizontal limb. Let me see if I can. Okay, there's one joint here and one joint here, which will allow for microscope to have a big range of movement. And this is a lock for the balance arm. It has a counterweight that should be well adjusted so that microscope doesn't fall onto the patient or move up as you operate. And that is something that we all should know. And there is always a screw that adjusts the counterweight at the start. Just give the microscope a swing up and down, and it should not move after it is stopped. All of us have seen this with regards to the mobile phone. It works for any activity, be it the slit lamp, be it the microscope. If we keep our head straight and looking straight ahead, it is the best way to protect your neck. And the eyepiece, the high-end microscopes have got tiltable eyepieces. So adjust it so that you're looking straight ahead as you're operating or as you're observing a patient on the slit lamp. Else you need to bend your neck, and that will add up over the years as neck strain. If one is going for a fixed eyepiece microscope, go for a 90-degree one rather than what is shown here, which is a 45-degree one, where you will be forever looking down as you operate, and that adds to neck strain. XY should be centered at the start. You need the full range when you're actually operating, so that should not be forgotten either. Adjusting the IPD, this is important. If you're converging or diverging to fuse, it is going to add to your headache. So keep both eyes open as you start. Widen the IPD till the two circles are fully illuminated with no shadows on either side. Look away once, because you might be doing a cover test or converging with the object too near, and check again. The microscope is optics are actually for distance vision and not for near vision. So when you're looking away is the type of accommodation you should be using while you're operating. I've seen people trying to close one eye at a time and adjust the microscope. You're doing a cover test. If you've got a phoria or atropia, you're not going to be okay at the end of it. So this is what I was saying. Very wide, you will see two circles, and if you're starting to see a shadow in the middle, it needs to come in further. It's too wide still. End point is a complete circle with no shadows. If you get too close, you will have shadows on either side. Most of the PGs, when they start, they would converge and put the eyepieces all the way to the center. I mean, nobody's got a snake's IPD. You all have somewhere in the mid-range of their IPD possibilities. To be comfortable in microsurgery, you should be comfortable as well. Your back should be straight and relaxed, not bent over or overstretched. And you should be able to reach the foot pedals with ease. And neck should be comfortably positioned. I've gone through that already. So basically, you need a slight tilt to the microscope like this so that you do not have to lean forward right through the surgery. A 10-15 degree leaning forward will not hurt in the first 15-20 seconds, but then if your surgery goes on for 40 minutes, end of it, you'll have trouble getting up because your back's starting to hurt. So, wait a minute, what was it? When you're sitting temporarily, you're further away from the patient, temporal section phaco, you need to tilt the microscope a lot more than what you are doing when you're sitting at the head end and operating. This tilt is much more. Foot pedal switches are configured differently. Always check it at the start so that you don't get surprised in the middle of the surgery. Position them so that all foot pedals are easily reached with your feet. Use a footstool under the foot pedals if required. If you're not tall enough to get to the foot switch easily, your knee should not be hitting the table either. So the table also needs to be adjusted so that when you move around on the foot pedal, you're not actually moving the table as well with your knee. Your joints should never be at the end of the range of movement. It should be somewhere in the middle when you're starting itself, because that's where you want to be when you're actually working. Chair height should not be too low or too high. At the end of the surgery, you need to get up. So if it's too low, it's going to add to strain on your knee. And when you get to somewhere around my age, you will feel it. Your hands are supposed to stay sterile. So unlike sitting on a chair out here where you can put your hand down and lift yourself up, you cannot do that during surgery. So your entire strain is on your knee. So do not sit too low. Your joint should be at mid-range, as I'm showing here. It's never at the end of all your joints. It should never be at the end of the range of movement. You need a chair that goes up and down, table that goes up and down, and of course a microscope that goes up and down. And a combination of three of these adjustments can adjust it to any surgeon's height. And once the surgery starts, we'll compromise on our musculoskeletal system because we're bothered about what's happening in the patient's eye, and we'll realize only at the end of the surgery. Good. First, adjust the chair height always, and then make sure the foot pedals are reachable, and then the table height is not adjusted. The microscope is placed where it should be. It won't be in focus. Once the microscope is placed in position, I'm finishing up. Then the table is brought up to bring it to focus. That's it. For your instruments, you use pill rolling movements, and your fingers are the ones that are working. So you always try to find a wrist support so that your axial muscles are relaxed. You can find the patient's forehead, zygoma, wherever, put a little finger down so that your wrist onwards is supported. Thank you.
Thank you, Dr. Thomas George. The ergonomics of doing surgery as well as lumbar examination, it is very useful, especially senior citizens like me and Thomas George. Anyway, all these chairs are available when you go to any IT center and everywhere. All these special type of chairs are available for